Hi everyone. Yes, today we are going to see another yet a new chapter on the genetic testing for neonates and children. And the session which we are going to cover in the next 10 minutes would be on congenital abnormalities. So the word congenital itself, you can guess it out that it is soon after birth. The child is either developing internal or external defects. It is mainly purely due to any embryological changes or exposure to toxins when the fetus is in the your mother's womb. So that's the reason the child is developing congenital abnormalities. So the introduction here, the congenital deformity or abnormality is a broad range of either physical or might be the internal or external abnormalities existing soon after birth. So the major impact on the congenital deformities can also be either primary or secondary. So primary, like for example, as we saw in the earlier slide, which is developmental delay, or it can be due to secondary aspects such as low self-esteem or social ostracism. However, surgical procedure may help out, may or not going to help out these conditions where we have to go in for in depth of how to screen the diseases such as congenital diseases. So, congenital disorders can be defined as the structural or functional abnormalities that occur during the intrauterine life. So, otherwise, we can also call these as birth defects or congenital malformation. And these conditions are developing prenatally, so before or in birth, or might be later after birth, according to WHO. And I've also given another definition of congenital abnormalities according to NICHD. So now we are going to see about the incidence. So globally, you can see that there are about 30 to 70 of 1,000 population or 1,000 live births, child is developing congenital abnormalities, and in India, around the percentage would start up with 2.5 to 4 percentage, and most of the birth defects abnormalities on a higher percentage. You can see that is purely due to the central nervous system abnormalities such as anencephaly, microcephaly, or spina bifida, spina occulta. So these are the major defects which causes the central nervous system problems. So now, what can be the major etiology behind this congenital deformity? As we saw earlier, it is either due to genetic factor or might be due to environmental factor. In genetic factor, might be due to chromosomal abnormalities, single gene disorders such as autosomal or recessive traits disorders, or might be it is due to multifactorial inheritance such as combination of polygene and environmental factor contributing to both. And coming to the environmental factor, as we saw, it is due to exposure to torch like symptoms, the infections to the mother. How we can diagnose these child with this congenital problem? Either, as I told you, it's starting from intrauterine. So prenatal or postnatal can be, we can screen the child. So if it is it is in the prenatal, majorly we go in for detailed assays and studies on the mother. And if it is due to postnatal, we have significantly seen the directly either from samples from the child or the infant or the neonate are being collected, such as doing an ultrasound, radiographic examination, cytology studies, and blood studies, blood works, and so on. So now starting with the congenital deformity. So this picture you can see that all the intestines are being come like it is eviscerated outside the abdomen instead of being placed inside. The small intestine is totally being outside. So this is mainly a defect in the abdominal wall which causes the extrusion of the bowel, that is outpouching, or the full bowel contents are being outside and it is not being covered with the peritoneal layer. So this condition we call it as gastrochycus, and it is majorly a defect with the GI system. So malformation during the embryological period in the intrauterine life which causes gastrochycus. So the next picture when you witness, it is like showing the gastric contents, that is the large intestine and some part of the liver as well as some part of the small intestines, everything is being eviscerated outside. So this we call it as a defect in the bowel which protrudes through the umbilicus. And another thing is that it is being layered with the peritoneal layer outside. So, which shows that the embryological development has been delayed, or it is not fused during the fetal process. This condition we call it as omphalocele. Now coming to this, when you see this picture, it is pyloric stenosis. So you can see have given a picture like comparing a normal and the abnormal pylorus. So in a normal pylorus, which is very close to the duodenum and the basal portion of the stomach, body near the lesser curvature and the greater curvature, the ending portion is your pylorus. So here the pylorus has now become very much narrowed. So that condition we call it as pyloric stenosis. So it is mainly due to the hypertrophy of the muscle of the pyloric sphincter. This condition is also yet another of GI abnormality. And when you see this picture in close, you can see that there is no opening of the anal orifice. Otherwise, we can call this condition as imperforate anus. So, always when a fetus is being born, we screen by giving the rectal thermometer, or might be we use the digital finger or the infant feeding tube to find whether there is any fistulas or might be fissures in the ano. But if it is totally sealed, we cannot do any such procedures which is totally contraindicated. So this condition will be coming under renal atresia. So next is the heart springs disease. So you can compare, that is the normal ganglionic cells, and when there is no ganglionic cells, what happens to the large intestine. So this deformity is mostly seen in the sigmoid colon and the rectum. Here, what happens is the ganglionic section of the cells of the large intestine is totally absent, and because of this absence of cells, there is no peristalsis, which causes dilation as well as enlargement of the large intestine in the sigmoid and the rectal colon. Next is in this picture, you can see that the child is having abnormality in the lip as well as in the palate. So here it is mainly affecting the either the soft palate or the hard palate or both the palates. This is also another deformity which is caused in the GI system. So the normal palate in the first picture you can see it is totally not divided, but in the next two pictures you can see that either there is unilateral or bilaterally the cleft lip and palate being present in that particular child. So this is also an embryological defect which can be screened by doing genetic testing. The next important congenital deformity is that diaphragmatic hernia. So hernia is nothing but outpouching of the particular organ into a cavity. So here this causes diaphragmatic hernia, which is causing the defect in the diaphragm that allows the herniation of the abdominal contents into the thoracic cavity. So what happens when the abdominal contents are going into the thoracic cavity? Definitely there will be disturbances in the GI as well as respiratory problem and cardiac problems. So congenitally the child will be having associated defects as well in those conditions. This is a picture which shows that it is a coanal atresia. So here coanal atresia is like in the first picture you can see that there is a good air passage from the nasopharynx to the larynx. But here in this totally the coanal atresia, what happens is the bone is totally blocking the nasal passage. So either it can be unilateral or bilateral, which causes there is web of tissue being growing onto the nasopharynx. In this disorder, you can see that the child will be having mostly aspirations, as well they will be showing of mouth breathing. The next congenital deformity which affects the musculoskeletal system is polydactyl and syndactyl. Polydactyl in the first picture, you can see there is extra digit of hands or foot. So in this picture, there is extra digit of the thumb. And in syndactyl, the either the fusion of the digits or webbing of the digits of hands and foot can be seen. So in the second picture, you can see the index finger and the ring finger are being webbed together. So that is a syndactyl. So next we'll be seeing about the condition which is affecting the central nervous system. So the central nervous system is like you have the microcephaly and anencephaly. So in microcephaly, the head circumference is less than 2 percentile. And in anencephaly, you can see that the fetal brain or skull is not fully developed in the uterus. So these two type of disorder children will be having motor issues, fine motor and gross motor issues, as well as sensory issues, lack of self confidence, and then they are not having awareness to the surroundings as well, and totally they may be dependent on others. In certain babies soon after birth, if it is an anencephaly, the child may be declared soon after birth as well. And this is another central nervous system issue, which is purely due to congenital. The first picture is spina bifida occulta, which is like a small separation or gap or of one or more of the spine. And in closed spina bifida, the second picture which shows that like failure of the fusion of the vertebral disc to the vertebral posterior vertebral arches. And you have the third picture meningocele and the fourth picture meningomyelocele. In meningocele, what happens is the spinal fluid is being bulging through an opening through the vertebral area. And in meningomyelocele, the myelin sheath of the spinal cord is also being covered. So coming to the summary, so there are more other congenital defects. So where I have only pictured the important congenital defects, some of the congenital defects which occurs in the heart, which we call it as acyanotic, cyanotic, and mixed defects. So in this picture, it shows the congenital heart defect of acyanotic, which is the first one, atrial septal defect, ventricular septal defect, and you have the remaining two, which is the mixed defect, that is coarctation of aorta and tetralogy of Fallot's. So to conclude the topic of congenital disorders, so there is many other conditions which also attacks the bone as congenital deformity, which we call it as brittle bone disease. So in this, the child will be having blue sclera, dental imperforations, and sensorineural hearing loss with multiple fractures. So these conditions also play a major role in the congenital deformity, and these also can be easily screened by doing the genetic testing and so on. So by the end, you will be able to define what is congenital deformity, list out the four congenital deformities, enumerate the common congenital deformities which attacks the central nervous system, and you will be able to explain the possible etiology behind the congenital deformities, which is, like I told you, genetic and environmental factor play a major role. And you'll be also able to define or differentiate between cleft lip and cleft palate. In palate, both the hard palate or the soft palate or both are being involved. In lip, only the lip fissures is there. And to here are some of the references which I have seen and gone through for the congenital deformities. You can also screen into many other textbooks and the online platforms. So don't forget to read the full content. And if you have any queries, please feel free to post your comment onto the comment box and give up your suggestion onto the comment box, like how it can be improved in other videos. And thank you for your patient listening. Don't forget to like, subscribe, and you can share the video to your friends as well for their study purposes. Thank you all for your patient listening. Thank you.